Assalamu alaikum. Hello everyone. This is Dr. Zahra Alhaj Issa. I'm a hematology consultant. I was really hoping to be there in person today. However, I had to do it on video recording as I am traveling outside the kingdom in the current time. However, I will take you through my slides and I'll be happy to answer any questions either after the lecture or through my email that I will share in the end. Thank you again for inviting me. So, first lecture is about bone marrow aspiration and biopsy procedure. It's going to be directed to our dear nursing staff. Bismillah. So, we're just going to refresh your mind about the definition. So, bone marrow aspiration and biopsy are diagnostic procedures used to obtain samples of the bone marrow for examination under a microscope. And why would we do that? We'll go through the indications later on, but it's a diagnosis, so we're looking for any abnormal cells indicating hematological malignancy or disorder like leukemia, lymphoma, multiple myeloma, or like the functionality of the bone marrow. So indications, when do we schedule a patient for a bone marrow biopsy? So there are multiple indications, as you can see here. Unexplained anemia, thrombocytopenia or leukopenia, if we suspect any hematological malignancy from a peripheral blood smear, for example, or a patient is already a known patient for hematological malignancy and we want to see the disease progression, the response to treatment, so we can move the patient from one stage of the treatment to another, or we need to change the whole treatment protocol. And sometimes we do it to look for unexplained fever, unexplained weight loss, or a bone pain that simple, less invasive procedure couldn't diagnose. So if any of you have attended the bone marrow biopsy before, you're going to be familiar with the equipment. And I would really suggest, if a new staff or a staff who hasn't observed the bone marrow biopsy before knows that her patient or his patient is scheduled for a bone marrow biopsy, don't be shy to ask the physician, what do I need to prepare? That's going to be much smoother process than at the time of the biopsy to look for the stuff and gather it in a rush. So sometimes in our hospital we have a ready bone marrow kit, but most of the time we don't. So what we need to collect is a bone marrow aspiration needle, a biopsy needle. Usually we have it in one kit. Local anesthesia, lidocaine, for example, 1 or 2% depending on the physician preference. You need multiple syringes and specimen containers. You need sterile drapes, sterile gloves, and sterile gown. And you need antiseptic solution like chlorhexidine or bivadine iodine. You prepare all of this on a table nearby the patient. Then if we go to the patient preparation, so you always make sure that there is a informed consent done by the doctor, witnessed by you or other nursing staff, and you make sure that the patient knows the procedure. And then, as usual, documentation is of utmost importance. So you always need to acknowledge the patient's medical history, allergies, and his current medications. For example, sometimes patients are on anticoagulant that we need to hold before the procedure, and different drugs need different time to be out of the system. For example, 1 day, 12 hours, and so on. And then you explain to the patient, as you have the strongest rapport to the patient, the importance of remaining still during the procedure and to provide reassurance. Sometimes, if there are more than one nurse around the patient, one nurse will usually just try to encourage the patient to remain still, hold their hands. However, sometimes, due to the shortage of the staff, one staff will be helping the doctor and giving support while being on the other side of the patient. And you always need to verify the patient identity and confirm the procedure site. So the technique, it's more related to the physician doing the procedure, but you need to know the steps, so you are following the process. So first is positioning of the patient. Of course, the nurse and the doctor both will help to reach the proper position. Usually we put the patient on a lateral decubitus. Some cases we put them on a prone position. And then the doctor will sterilize the area and administer the local anesthesia to the skin and the periosteum. After a while, the aspiration process will start with the aspiration needle, where we aspirate a small sample of bone marrow fluid into syringes. So, as you may have seen before here in our hospital, the current policy is that there is a bone marrow technician assisting us in the bone marrow aspiration and biopsy procedure, and they are the one responsible to take these samples and deliver them to the lab. However, in some hospitals, and maybe it's going to change here also, it's the role of the nurses after a proper training and certification. Then, after we handle the bone marrow aspirate, we move on to the biopsy. So we switch to another needle usually, or we switch the head of the needle, and then we advance the biopsy through the same skin incision into the bone marrow, and we apply a controlled manual pressure to get a core biopsy specimen, and we go outside and withdraw the biopsy slowly with applying pressure afterward to control the bleeding. So that's the process. I'm sure explaining it is not the same as seeing it, and once you see it one time, you will get it. You will get a more clear picture. So, complications and the nursing considerations. So, what can happen during or shortly after? Bleeding. So, you have to monitor for signs of bleeding like hematoma, excessive oozing at the procedure site. Other important complication is infection. So, you need to maintain aseptic technique, you and the doctor, during the procedure. And then afterward, you need to assess for signs of any local or systemic infection. And pain, we need to provide the patient with the proper pain management and to assess the patient's pain level regularly. As for the specimen, again, here in our hospital, usually it's handled by the bone marrow technician. However, we need to know that, of course, each specimen is labeled accurately with the patient information and the specimen type, and it should be transported promptly to the lab for processing and analysis, as it's very fragile cells, and if it dies, many of the tests cannot be done properly. So again, what do we do after the procedure? We apply a pressure to the site until the bleeding stops, and we cover the site with a sterile dressing, and we monitor for bleeding or hematoma. And we instruct the patient to avoid any sternness or heavy lifting for 24 to 48 hours. And we ask them usually to stay lying on the bed for at least 1 hour. And we provide them about education about potential complications and when to seek medical attention. Of course, again, document. You have to document the procedure and the patient's medical record, you and the physician, including pre-procedure assessment, consent, the procedure details, and post-procedure care. And you need to record the patient's response to the procedure, any complications or any additional interventions that was done to the patient. So that's all about the bone marrow aspiration and biopsy. Here are some references for further reading. And we'll see you in the next lecture, inshallah.